Chris Trimble here, coming at you from Dartmouth College, and I'm so happy to say that Shannon Jackson has joined me on the phone today. You've read just a little bit about her, and I want you to hear from her directly. So Shannon, welcome. Thanks for joining us.
Good morning, Chris.
Shannon, what's going on today? It's February 2016. You've been at work on the Elder at Home program for several months now. What's most pressing for you right now?
Well, I would say that my team is digging into increasing patient numbers and clarifying our day-to-day roles. We now have 5 medical providers in addition to the work that I do, and so we're increasing our team numbers as well as the number of patients we can see. I'm starting to meet with my providers to establish their personal goals, their team goals, and our programmatic quality goals for the next year. And we've discovered that our initial plan of multidisciplinary teamwork with all our patients is not really a one-size-fits-all, and we're trying to look at population health and how we might be able to serve our broad population using the staff we have for our more active and healthiest patients in a less intrusive way, and for our patients that are sickest and in transition, how we can be there for them in a more intensive way. So having to rework our initial strategy a bit to meet the needs of our patients.
Is anything that's happened recently surprised you, such that you're moving in a different direction that you originally anticipated?
Well, I think that the point that I was just speaking to at the end, it's been a surprise for us. When we initially got our list of patients, target population that the health plan was hoping that we would be able to see, they all had at least 6 major chronic medical conditions. They all had been in the hospital in the last year. And we crafted our approach thinking that all of these patients would want us to come and see them at home, would want to engage us in chronic disease management and goals of care, future planning. And what we really found was there was a huge range of patient needs. And so we're right now in the process of adjusting our services to better meet the patient's needs in the moment where they're at.
Tell us a bit about perhaps 1 or 2 patients that have been particularly satisfying for you to work with recently.
Well, I can tell you about a couple patients that I've seen that have been really interesting cases. I had an 85-year-old woman who lives in an assisted living facility whose family said that she'd had some memory trouble for the past couple of years, but she, up until the past 6 months, had been independent in the community, calling a taxi or able to do her own shopping. But in the past 6 months had been increasingly confused, bizarre behavior, feeling like people were spying on her from the parking lot. People were stealing things from her, like her underwear or papers from under her bed. And her PCP had seen her and diagnosed her with dementia and as well as depression, and had been prescribing increasing amounts of antidepressants and Aricept for her memory trouble. And they also asked us to see her in the home and see if we could figure out also if there was anything else that she needed or if memory care would be the right next step for her. So went to the house, and she presented originally as very organized, but as you got to talk to her, very paranoid. And what we found in meeting with her was that she was buying bottles of over-the-counter medication. And in her room, she had about 6 bottles of NyQuil, about 10 bottles of Benadryl and Tylenol PM, and all of these medications that were contributing to the symptoms that we were seeing. And you know, it's kind of a classic geriatric story. I think probably all geriatricians would tell you something like this. But it was very satisfying to be there and to be the one to find it, and then to work with her and her caregivers to make a plan to remove those from her room. And also worked with a mental health nurse practitioner to see her and to stabilize her prescription medications. And it's about a month later now. She's doing much better. We also were able to work with her family to get her an assistant for shopping, the hired caregiver assistant, who monitors the things that she's purchasing or discourages her from buying over-the-counter medications. And she's much better. I would say that the stability of her placement there at the assisted living is looking good, and that she wouldn't need to move to memory care. So that was a case that I enjoyed working on. Let me tell you, another interesting case is a woman who is 80, and her husband was also in his 80s. They lived in their own home here in Portland, and she has pretty bad sleep apnea. She had been to the hospital a couple times in the last year for breathing trouble related to her sleep apnea, and it was suggested that she would be able to breathe better and have lower risk of going to the hospital if she had a tracheostomy, so that she could keep her oxygen levels and her oxygen levels up and carbon dioxide levels down. She got this tracheostomy. It was complicated by various things in the hospital, including her becoming very confused, and her hospital stay was about 3 weeks. She ended up going home and needed to have a ventilator to support her breathing at night. And when she got home, the respiratory therapist came to her house and instructed her husband and her on how to use the ventilator and the suction machine. And I had met her before she went into the hospital, and they called me out later that night to come and see her because they couldn't make heads or tails of any of the equipment. And, ventilators these days are so complex. There must be 50 buttons on this thing. And when I got there, it was so funny because her husband just said to me, you try and run this thing. You look at this thing. And we, push the power button, and it's all this glowing panel of red and green buttons, and I feel like I'm trying to launch the space shuttle. And there's a whole closet full of these ventilator parts that look like Lego parts. And the husband's just befuddled, and she, of course, has no clue. She ended up going back to the hospital and making an alternate plan for her. But I enjoyed enjoyed having that relationship where they called me out to say, what are we going to do about this? This can't possibly work for us, because it's just the two of them at home. So we were able to make another plan for her for safety.
Well, Shannon, thanks for sharing these two stories. I'm excited about your program and its prospects for growth, and it sounds like you are enjoying your work. And I thank you for your time this morning, and hope I have the chance to continue learning from you in the future. Thanks so much.
Oh, thank you. Thanks so much, Chris.
Cheers.
Good luck to you. Bye.